Okay, we can go ahead and get started. Good afternoon, everyone. The Washtenaw County Health Department and the Washtenaw County Medical Society are pleased to provide this webinar as part of our 2021 Cannabis in Practice series. Visit the Cannabis in Practice webinar series webpage for updates, link to our archived webinars, and more. And the link will be added shortly into the chat. Today, our speaker is Grant Richardson. Grant Richardson is a social entrepreneur and a social equity advocate in the Illinois cannabis industry. Grant co-founded the Illinois Cannabis Training Center in 2019 to increase access to opportunities in cannabis for social equity communities through innovative, interactive, and immersive education. Grant is also an organizer with the Cannabis Equity Illinois Coalition. In addition, Grant is also a member of the Minority Access Committee at the Cannabis Business Association of Illinois, and he is also part of the Diversity, Equity, and Inclusion Committee at the National Cannabis Industry Association. And we'll go ahead and let Grant take it away.
Awesome. Thank you, Naba. I'm so excited to be joining you all today in this presentation that's called Social Equity and Medical Cannabis, Advancing Equity and Justice through cannabis legalization and through the medical cannabis industry specifically. So I have an exciting conversation planned for us today. I'm hoping that we ultimately have a generative conversation that allows you to see opportunities where you, from where you sit, wherever that may be, can help contribute to advancing social equity efforts. So with that, let's go ahead and keep rolling. So first, I just want to remind us that we are in the midst of a once-in-a-generation opportunity. We know and are beginning to realize the tremendous implications of cannabis legalization on our communities, on our society as a whole, both at the individual and that community level. So when we look at this once-in-a-generation opportunity, I think it's very important that we consider for who are these benefits accessible. So as I mentioned, my name is Grant Richardson. I'm a social entrepreneur, a founder, a teacher and facilitator, and I'm a strong advocate for social justice. From the variety of seats that I currently sit within, I am constantly thinking about how can I use my role to contribute to ensuring that cannabis is improving our communities to the greatest extent possible, which is really what this presentation revolves around, what my career has evolved around is, again, what would it look like if cannabis was improving our communities to the greatest extent possible? So with that in mind, I want to look at the presentation objectives that I'm bringing for you all today. Within this presentation, the goal is that you as a participant are able to find some level of success as measured by your ability to lead this conversation with a better understanding of these objectives. First, we'll be able to analyze present and historical data on the cannabis industry to understand the why behind social equity advocacy. We'll discuss the harm and trauma caused by cannabis in disproportionately impacted communities and the impact that has on their use of cannabis as medicine and their participation in the benefits created by cannabis. We'll understand the importance of expungement and record clearing for justice-involved individuals. We'll identify barriers to social equity in the medical cannabis industry, and we'll understand strategies for the medical cannabis community to advance equity and justice through cannabis. Before I go much further, I want to do a quick pause just as a thank you. While I did do various, first, thank you to the Washtenaw Society for welcoming me to this space, but also want to give a special shout out to a number of individuals who I actually interviewed, specifically Bahia Lee and Tiffany Reynolds of Soul and Wellness and Indicated PhD, respectively. They really contributed to a portion of this presentation that I'm very excited to be sharing with you all today. So again, if we are successful in this presentation, we will have left this conversation with a better understanding of these objectives as outlined here. Some agreements for participants, for all of us as we engage in this space. First, as your presenter, would really ask you to lean into engaging with me. I have the chat box up over here on my other screen, so would love to see your reactions in the chat. We'll be having a number of polling opportunities. Would be greatly appreciative if you actually respond to those polls and participate as such. If you have any questions at any time, always ask. use the chat box or the comment section if you're watching this recording later on to ask your questions. We'll try as best as possible to address as many during our Q&A portion of the event. Have a growth mindset. While some of the concepts that are mentioned here today may be familiar to you, there's always new ways that you can identify opportunities to grow in your understanding of these various dimensions of social equity and continue to develop an understanding of how you ultimately think and lead with social equity. So I ask that you have a growth mindset. Be accountable. There's a reason that you're joining this conversation on this Tuesday midday. I would ask that you keep that intention in mind throughout the course of this presentation, that you are intentional about holding yourself accountable to achieving that goal. And then follow up with myself as your presenter, with other participants that you may connect through this space. Follow up by taking this information forth to continue to advocate for social equity any and everywhere we need you, wherever you're coming to the space from. So we'd love to actually start out with a poll. And that poll question is, what is social equity to you? So I'm going to launch this poll now. And I just want you to go ahead and respond. It's a multiple choice poll with, what is your current understanding of social equity? What is social equity? So social equity is, go ahead and submit that poll on your screen today. You should just be able to click in. So what is social equity is the question. Okay, seeing a few responses clicking in. Awesome. All right, so we have some good insights. It's clear that we already have some perspectives to share. So I'll share those results quickly, where we can see that the majority of us see social equity as creating opportunities for women, people of color, and other underrepresented groups in the industry. We see second most promoting access and participation within disproportionately impacted communities. And then finally, helping Black and Brown entrepreneurs get licenses in the cannabis supply chain. So I hope some of you selected multiple options, because I do believe that social equity covers and touches on all of these various dimensions, but specifically to look at what the state of Michigan says through the Michigan Marijuana Regulatory Agency. They define the purpose of their social equity program as being to promote and encourage participation in the marijuana industry by people from communities that have been disproportionately impacted by marijuana prohibition and enforcement, and to positively impact those communities. They continue on to say that they seek to become a leader in diversity, equity, and inclusion, not only in the state of Michigan, but across the nation and the world. They want to see themselves as a model for what it could look like for states to do social equity well. So that's a great definition to start with. And it brings to mind these kind of key terms, this jargon that's thrown around quite a bit of diversity, equity, and inclusion. I'll just summarize these key terms here, taken from the Center for the Study of Social Policy. But we know that diversity is relatively a synonym for variety. It means how many of these are in the room. When we talk about equity, we're actually talking about leveling the playing field, making it so that we're providing different levels of support for individuals so that they can actually achieve fairness and outcome. And we finally have inclusion, which is a state of belonging, whether or not a person actually feels that their perspective is valued, that they can show up as their authentic self. So these, no doubt, are important terms, but I think something's missing. And that one word that I believe is missing here is justice. Where does justice have a play in the state of Michigan's social equity efforts? And specifically, there are two types of justice that I want to talk about today. And those are social justice and restorative justice. I believe that if we can lead with these two types of justice, we can achieve all of those aforementioned goals as it pertains to engaging those disproportionately impacted and engaging those who are underrepresented, as well as becoming leaders in diversity, equity, and inclusion. That by prioritizing justice, we can achieve all others, but it doesn't necessarily work the other way around. That by prioritizing diversity, equity, and inclusion, I do not necessarily believe that we would also be able to achieve justice. So let's talk a little bit more about these two types of justice and get a little bit clearer on definitions. So first we have social justice. Social justice is a process, not an outcome, which seeks fair redistribution of resources, opportunities, and responsibilities. There's that equity piece. Social justice challenges the roots of oppression and injustice. It empowers all people to exercise self-determination and realize their full potential. And it builds social solidarity and community capacity for collaborative action. So I'll take a moment just to let this sink in with you and to think about what are the implications for social justice when we think about our social equity efforts. Next, we can look at restorative justice, which is a theory of justice that emphasizes repairing the harm caused or revealed. It is best accomplished through cooperative processes that include all stakeholders impacted. And restorative justice is often thrown as being more commonly utilized as a term as it relates to transforming our criminal justice system. But in this case, again, it's not an individual who necessarily caused harm. In this case, we have a system, we have a state, we have a nation that has relied on cannabis for decades as a tool of racism, as a tool to continue to cause harm that we'll explore later on. So what does it mean to actually repair the harm caused when we look at community as the victim, and very specific communities to be transparent? So again, these two forms of justice have to be central in our social equity efforts if we are to achieve those goals of promoting access by those that were disproportionately impacted and achieve that goal of becoming leaders in diversity, equity, and inclusion. To achieve social equity, we must lead with justice. So before I go much further, I want to hear a little bit more from you in terms of your perspective. So again, going to ask you to jump into the chat here, lean into a little bit of discomfort with being public facing, and let us know, why is social equity important to you? So I'm going to give us a moment here. Please just go ahead and type in the chat. Why is social equity important to you? So while you all go ahead and jump in the chat, I'll go ahead and share a few reasons why it particularly matters from my perspective and from others that I've shared with. First, we know the legacy of cannabis, and we know that that legacy is tainted by trauma, racism, and oppression. And we also know that the communities that were most impacted by this legacy of cannabis are still suffering from the impacts of the war on drugs and the criminalization of cannabis. We can look at this a little bit more specifically with some data points that are presented on this slide here. For example, from 1980 to 1997, the number of people incarcerated for nonviolent drug offenses increased from 50,000 to 400,000. So this is the ramping up of the war on drugs, where we see a 700% increase in those incarcerated for nonviolent drug offenses. In 2010, we saw that arrests for cannabis were 52% of all drug arrests. And in 2018, we saw that Black people in the US were 3.6 times more likely to be arrested for cannabis than white people, despite similar usage rates. So all of these demonstrate that cannabis was used and is still used as a tool to drive mass incarceration, that racial profiling over policing based on zip code, race, identity, then leads to higher arrest rates and incarceration rates, which then leads to over-sentencing. A report from the American Progress Center found that Black defendants convicted of a non-violent drug offense were as likely to be sentenced to the same amount of time as a white defendant who was convicted of a violent crime. So we really see, again, cannabis and the war on drugs, it really used as a tool of oppression. To look a little bit closer at this data, specifically a great report from the ACLU, which had a number of findings, specifically that the war on marijuana, the war on cannabis continues and is still widespread across the US, even as we see legalization efforts ramp up, that racial disparities in marijuana possession persist throughout this country and have not improved at all since 2010. And even in states like Michigan that have legalized, or other states that have decriminalized, we've seen incredible trends this last year, that even after legalization and decriminalization, although we see the number of arrests decrease, we ultimately see racial disparities in arrests remain persistent and actually grow in some instances. Here's some specific data, just so you can look at the US. Again, on average, 3.6 times more likely for a Black person to be arrested for cannabis possession. You have some outliers here. For example, in Montana, you're 9.6 times more likely to be arrested if you're Black than white. And in Colorado, on the lower side of the spectrum, the best state, still with real disparities. And then in Michigan, we have the state, which is on average with the US in terms of the disproportionate impact on marijuana arrest. But we see even broader outliers, such as in Clinton County, where 21.5 times more likely to be arrested for cannabis possession if you are Black. And on the other side, Gratiot County, that's 1.3 times more likely. So I'm curious where you all see Washtenaw County falling in the grand scheme of things. So I have another poll for you that I'm going to launch now, which is to get a sense. What do you think? If you had to guess, true or false, Washtenaw County has outcomes that are better than or equal to the state and national average when it comes to racial disparities in marijuana or cannabis arrest. What do you think? How does Washtenaw County perform? Okay, interesting. Right now we got a split crew. Click in your answer. What do you think? Y'all know Washtenaw County. Does it perform better or worse than these national averages? All right, so I'll share results quickly. We had some optimistic individuals in the room, so you likely maybe are more involved in efforts where you see Washtenaw County being intentional about reducing racial disparities. However, the reality is that the results show that Washtenaw County is higher in terms of Black people and their likelihood of being arrested for marijuana possession than both the national and the state average. That in Washtenaw County, if you are a Black person, you are 4.7 times more likely to be arrested for cannabis possession. So we know that there are real disproportionate outcomes when it comes to who is actually impacted by the war on drugs and the war on cannabis. And we know the realities that arrest, that mass incarceration have caused incredible harms. So what happens to the harm that has been caused? Well, first it goes beyond just that individual that maybe have been impacted by that arrest or maybe have been impacted by that record, that it impacts the ecosystem with life-altering consequences, both the victim, the family, and the community. The family may face eviction. Parents may lose their children. Children may lose their parents. Long-term unemployment is experienced by those who actually experience an arrest or an incarceration due to cannabis. We also know that a continued exposure to harm and the failure to address past harms, ultimately that this harm transforms into trauma, which is passed down from generation to generation. And this results in a loss of trust in institutions of public safety and well-being, which we see across communities, across the nation, across the state of Michigan, that communities no longer trust those institutions that could express the intention to support their well-being and safety. We also know that it continues to result in a fear of cannabis, that there's a lasting stigma around cannabis use and cannabis users that directly traces back to this harm that was caused. And we also know it can lead to toxic stress, it can lead to adverse childhood experiences, and it has contributed to a real mental health crisis that we are now in. Cannabis and the legacy of the war on drugs has contributed substantially to the mental health crisis that we specifically see in disproportionately impacted communities of the war on drugs. So my question for us is, how will we ensure through our social equity efforts that disproportionately impacted communities have the resources to repair from the harm caused by the legacy of cannabis and cannabis policing? Next, I'll look at another dimension of social equity, which is, and when we think about, we just came from the historical context, right? Understanding the legacy of cannabis. But we also know that presently, in the reality that we exist within today, that we are still experiencing disproportionate outcomes in participation in the benefits of cannabis legalization, whether that be participating in the industry as a member of the workforce or as an owner, or participating in the benefits of cannabis just as a medical cannabis patient. So we want to look again at some more data that really expresses these disproportionate outcomes. So first, some data from the MRA, which found that in a survey conducted in December of 2020 on ownership interest in a cannabis business, that 3.8% of those who identify themselves as having an ownership in a cannabis business, 3.8% of those individuals identified as Black. 1.5% of those individuals identified as Hispanic or Latino. So we see comparatively to the percentage of the population that the communities in the state of Michigan, we just looked at the data, that were disproportionately impacted by marijuana arrests, by the criminalization of cannabis, are now disproportionately underrepresented when it comes to the highest levels of this industry. At the highest level, we know that's where the greatest amount of economic benefits, of generational wealth, where are those opportunities? They exist at the ownership level. And here we see disparate outcomes of Black and Brown people in ownership within the state of Michigan. So when asked that question of can you break through, the reality that's presented to most Black and Brown people is, well, look at the data. What does it say? Are they more likely to break through than their counterparts? Are they more likely, just as they're more likely to be arrested, to be able to access ownership opportunities? And very quickly, we see that the answer is no. On the other side of things, when looking at participation in the cannabis workforce, we see here some data from Marijuana Business Daily that shows the percentage of female minority executives in the cannabis industry. Recognizing, again, that this concept of intersectionality, that our identities come together to shape our lived experience, that we can't only look at the experience of Black people in the cannabis industry or the experience of people of color in the cannabis industry, but that when we look at the experience of people of color who also identify their gender as female or as women, or who potentially are gender non-conforming, they continue to face barriers to equitably accessing opportunities at the executive level. So yes, we see a great representation in ancillary services and firms, but we know where the greatest amount of economic opportunity lies within this industry, and at least within an individual business opportunity. And as we continue to move further down the line of profit margins for these various opportunities, excuse me, y'all. My apologies. Okay. That we continue to see barriers and that we continue to see disparate outcomes, that only 1.3% of vertically integrated MMJ or recreational businesses in the cannabis industry have female minority executives, which is incredibly disappointing. Here we see more data on the breakdown of marijuana business owners and founders by race and business type, that again, white businesses represent 81.3% of plant-touching cannabis businesses and 80.7% of ancillary cannabis businesses. Recognizing again that the communities that were most impacted, as from the data that we just looked at together, are now very much so facing barriers to accessing opportunities at the ownership level, at the founder level, across this industry. So real barriers that we have to identify are creating these disproportionate outcomes. And then finally, a little bit of a different look at industry participation, which actually looks at a Florida study conducted on medical cannabis patients. And in this study, there's emerging evidence that shows that minorities are underrepresented as medical cannabis patients. So here's a graph that shows survey results in terms of respondents and how they identify themselves and if they participate in the medical cannabis industry as compared to the Florida census data. And while we see that, and we can see pretty quickly, right, that Hispanic, Latinx individuals face barriers to accessing the medical cannabis industry, as they are not participating in a way that is representative of their population. The same is true for the Black community and other people of color. So real barriers exist when we talk about disproportionate outcomes. So I'll summarize with this statement, which is that disproportionately impacted communities are now underrepresented among those accessing the economic and medicinal benefits of the cannabis plant. So some takeaways for me when it comes to the questions that this data begs. The first is, what must our social equity efforts address? We have to address these questions. How can we ensure communities have the resources to repair harm caused in the name of cannabis? We looked at that legacy. We know the harms caused, and I was only looking at the dimension as it related to mass incarceration and arrest. We know the harm that caused. Do those same communities now have the resources they need to actually repair from that harm? And then on the flip side, we have to address the root causes that are leading to the underrepresentation of disproportionately impacted communities, Black and Brown women, in accessing the benefits of legal cannabis. So another poll that I have for you here, which is, what was your reaction to this data presented here? So would love for you to jump in the chat. What was your, or jump into the poll response. What was your reaction to the data presented on the historical context and the current industry dynamics in cannabis? Were you not surprised? You're familiar with this information? Were you surprised, familiar with this, with some of it, but not all of it? Or were you very surprised? You had no idea that these were the realities that that continue to persist when we talk about outcomes in the cannabis industry. So for most of us, we're seeing that we're relatively familiar with this data, that most of us are not surprised, that we're familiar with this situation, and we know the imperative behind social equity exists within this context. But also for an equal part of us, we were surprised, or very surprised, that we were actually shocked in some way, shape, or form by this information in terms of knowing the legacy of cannabis, as well as understanding these current industry dynamics that are playing out in the present. We can't only talk about these disparate outcomes as if it was a thing of the past. These are realities that exist with us today that our social equity efforts in our medical cannabis industry have to play a role in addressing. So I'll bring us back to these two definitions of social justice and restorative justice, and ask us, when we think about this context, when we think about these current industry dynamics, what does justice look like through our social equity efforts? How are we investing in a process that seeks the fair redistribution, that challenges the roots of oppression, that empowers all people and builds capacity within communities for them to take their own collaborative action to address these harms done? And how are we providing space for restorative justice? How are we ensuring and emphasizing repairing the harm caused by these systems of oppression that cannabis was utilized to perpetuate? So I would love for you to chat one word. How does advancing justice through cannabis feel to you? So go ahead and jump in the chat. When you are asked this question, it's an abstract question. What is one word? How does advancing justice through cannabis feel to you? Go ahead and jump in the chat. What is one word in terms of what this jogs for you in terms of feelings? While you do that, I'm gonna move now to some interview findings and takeaways, specifically around how can the medical cannabis community contribute to the advancement of justice. And again, I want to shout out my interviewees who were so gracious enough of providing me with their time, their energy to share their perspective. We had Tiffany Reynolds conduct an interview with me, who is the owner of Soul and Wellness. They specialize in medical cannabis services and education. They operate a family-owned cannabis hemp retail location directly interfacing with medical cannabis patients in the state of Illinois. And also had the privilege of interviewing Baia Lee, who's a registered nurse and the founder of Midwest Canna Nurses, which is advancing health equity through cannabis education. See Baia in the chat. Hello, welcome. And is also the co-founder of Indica PhD, which is a collaborative that creates a platform for people of color to talk and share resources about cannabis to promote health and healing. So these individuals provided with me their perspective around this question of what is the role the medical cannabis industry has to play when it comes to advancing social equity, and specifically medical cannabis providers or healthcare providers. So the first takeaway for me through this conversation was that we have to be collaborative. Time and time again, it came up that trust resulting from the realities that we just discussed has created a deep barrier to accessing the benefits created by the legal cannabis industry. And that through collaboration, by working with community, by building trust through partners, we can really break down these barriers. And when we're talking about collaboration, we cannot focus on siloing ourselves with just individuals who look like us or who sit in the same positions as us. That, for example, we have to engage licensees and awardees who have actually been awarded licenses and help them understand the importance of cultural competence, that we have to bring in other stakeholders like those impacted, like those who actually have positions of power when it comes to making and shaping policy. That through collaboration, we can identify the best ideas that will actually achieve improved outcomes, equitable outcomes when we talk about cannabis industry participation in the communities that were disproportionately impacted by that legacy. So it's through collaboration, it's through working with partners that we can build trust. And we all have a role to play, especially as healthcare providers, with navigating the various realities that individuals may be coming to us with when it relates to how much they trust our words when it relates to cannabis. Next, we have lead with education. Both of the interviewees center education as an essential component of their work, not as an option, as a necessity. If you're working at this intersection of medical cannabis and healthcare, you have to lead with education, have to ensure that you are making sure that you are addressing the information gap and the resource gap, and that intergenerational education is needed to remove these stigmas. This came up in both of our interviews, that individuals who are older need individuals who look like them, who are also older, who are already accessing the benefits of this plant to help with removing those stigmas. So we have to think across generations and make sure that our education is accessible to all. And we can also be very intentional about connecting people with resources to learn what the actual laws are, what the laws actually are. We know how tricky those laws can be to understand. We know the imperative in understanding those laws when it comes to making sure individuals are actually aware of the opportunities that exist within their communities. And I want to zoom in on a perspective shared from one of the interviewees that is really, how can we change the narrative? And a number of ideas came up from them that I want to make sure that I share, which we all have a role to play in changing this narrative, in disrupting the stigmas that exist around the use of cannabis as medicine, around the use of cannabis to access societal benefits. So the first idea that came up was, don't be a closet advocate or user. So many of us use and consume cannabis in ways that are healthy, in ways that we access those benefits, but we do so in private. I know I myself have been guilty of this, that we're afraid to share our cannabis story because we're worried about what others might think. And ultimately, this continues to perpetuate these barriers, these stigmas that exist around cannabis, that as we continue to be closet advocates, we ultimately withhold from our communities the realities that we are accessing the benefits of cannabis, and that maybe others within our community can do the same. Also, that education happens everywhere, that we can't just be about negative messaging, which is what we see most visibly, that communities need more and greater access to resources to actually understand the medicinal benefits of this cannabis plant, and the other side, societal benefits, that we're only focusing our narrative, we're only focusing our messaging on educating on the negatives, on driving while under the influence, on underage consumption, which we know are important topics, but that cannot be the only areas in which we invest in education. And finally, who is educating matters. One of my favorite quotes when I was in the classroom, I was a public teacher for a few years, and one of my favorite quotes was, "My kids will be what they will see." Well, the same reality exists when we're talking about disrupting the narrative in terms of who is actually able to access the benefits created by the cannabis legalization. Our educators have to share identities with those who are disproportionately impacted or who are underrepresented, so that those communities see themselves on the other side. They see themselves as active participants accessing these benefits, and thus are more likely to do so. Change the narrative. We also have to invest to heal, not just to invest. And that both looks like supporting those directly impacted through expungement and record clearing, which I'll talk about in just a moment. We also know that we can support those who are directly impacted by setting aside licenses and opportunities for them within the industry, recognizing again that those who experience cannabis arrest, or cannabis records, or cannabis incarceration are more likely to experience sustained unemployment, more difficulty accessing employment. So can we set aside economic opportunities that can help them rebuild, help them build wealth for themselves and their families? But we also need to take a holistic approach to healing, being more inclusive than just those directly impacted. Thinking, as I mentioned earlier, about the family, about the community, about the broader ecosystem that these individuals that were directly impacted were within, that were also tangentially impacted. So I want to talk a little bit more about expungement and record clearing, as this is a very important topic that we need to make sure we're sharing resources about. Millions of criminal records were created as a result of the war on drugs, as a result of cannabis-related arrests. We already looked at the disproportionate realities of who those arrests and those records impacted. So when we talk about expungement and record clearing, what we're talking about is ensuring that the court treats criminal convictions, treats arrest records as if they never occurred. We know records have tremendous impacts on an individual's ability to access public housing, to access scholarship for education, to access other benefits of being a part of our society. So we need to make sure that through expungement, through record clearing, we act as these records never happened, especially now because millionaires are being made within this industry and so many people are accessing the benefits that for so many decades were criminalized. There are a number of expungement resources that I wanted to flag and I learned about through my research. Shout out to Washtenaw County for this great infographic on the right, letting people know that now this is legal. These convictions should be set aside. There's also Project Clean Slate, which is a City of Detroit initiative to help residents get their criminal records expunged to gain access to better employment, housing, and educational opportunities. So let's make sure that we are actively presenting individuals who interface with us with the information they need to access expungement, because the reality is that individuals with criminal records are not very likely to expose those to just anyone willy-nilly. They likely hold those as a part of their private life. And so by being transparent about resources, by sharing these resources with everyone, not just individuals that we know have records, we can be more likely to reach individuals who may potentially be eligible for these expungement and record clearing services. We also have to advocate for policy change that addresses the root causes of systemic inequities. This idea came up that we have to invest our tax money to address social determinants of health, to address and invest in education and prosperity. That is, and this is the tax money that's created by the legal sales of cannabis. We also know that criminal justice reform is needed badly, that we should be shifting our focus to healing, and that we can let cannabis spark a broader movement for reform in our criminal justice system. We also have to invest in creating policy that supports Black-owned and women-owned small businesses in the cannabis industry. There has to be room for mom and pop shops. We know that these huge multi-state operators, that these huge multi-state medical cannabis companies are going to drive out small business, and that small business is going to be the opportunities that these disproportionately impacted communities are best positioned to access. So we have to make sure, as we're creating policy, we're keeping these underrepresented groups and disproportionately impacted groups top of mind. And then finally, we cannot just help people navigate barriers. We have to remove the barriers that exist. Again, our job is not to help people navigate barriers. The job of social equity is to remove barriers so that individuals do not face inequality when trying to access opportunities and benefits created by the legalization of cannabis and medical cannabis. So a few more takeaways on the role healthcare providers play. A quote from Bahia Lee: healthcare providers, this industry needs you. So when we think about the role that healthcare providers can play as champions in this space, one, we can understand that social equity can exist as a stepping stone to achieving health equity. That by achieving social equity, we can improve social determinants of health. We know that economic well-being has tremendous impacts on health, and that by achieving social equity, by ensuring individuals who identify as Black, brown, people of color, those from communities disproportionately impacted by cannabis, we can improve economic outcomes in those communities and thus improve health outcomes. So that by investing in social equity, we can also advance our health equity efforts. We also know that medical providers have a unique role to play when it comes to the amount of trust that they are already given. So how can this be respectfully leveraged when we talk about the trust that already exists within medical providers, that we already bestow upon medical providers, that we can leverage that trust if we think about it respectfully and we collaborate with communities to say, I know I have this trust in my institution. What does that mean for the role that I can play as an educator? What does it mean, the role that I can play as an advocate? And try to leverage that trust. We know that healthcare providers have a much needed and underrepresented perspective to offer in advocacy and regulatory arena. That lawmakers are making rules, it's a direct quote, lawmakers are making rules for medical cannabis without significant input from medical professionals. If that is not a problem, I don't know what is. That we know healthcare providers who specialize in treating medical conditions and ensuring that health outcomes are being improved in our communities are not playing a substantial role in ensuring that legislation around medical cannabis can actually contribute to positive health outcomes. So healthcare providers, we need your voice when it comes to advocating for policy around the medical cannabis industry. We have to get educated. Patients have led this movement up to this point. Healthcare providers are those that need to catch up. And we catch up through education by understanding fully the potential for the benefits of cannabis and where additional research is needed so that we feel comfortable from our positions making and advocating for our patients to access medical cannabis in a way that improves their livelihood. And then finally, the bias was something that came up in our interviews with regard to the bias that medical providers and some healthcare professionals have toward pharmaceuticals, that we have to get away from this bias and rid our systems and our institutions of policies and processes that allow this bias to persist, which is ultimately standing in the way of healthcare providers becoming proponents of utilizing cannabis and other plant-based medicines to address ailments that potentially we don't need to prescribe pharmaceuticals for. So I'll conclude just with the change starts with you. I think this is a great graphic here that really shows, again, if we're trying to influence at society level, we have to start with the individual. We have to start with our own education, with our own attitudes, our own mindsets, our own beliefs. And that through us as individuals, we can influence our relationships, that we can collaborate with individuals who are within our communities to then create change within our communities. And that by focusing on that local level, by focusing on our communities, we can then broadly have impacts on our society, and thus be able to contribute to what the MRA stated that I shared at the beginning, that they are a leader and a model for diversity, equity, and inclusion that can be advanced through the legalization of cannabis. So to conclude, just want to ask you to chat one more time. What is one way you plan to contribute to social equity efforts? So again, what is one way that you plan to contribute to social equity efforts? I'll share here quickly just some sources for the presentation. Again, want to give a special shout out to the interviewees that participated, both from Indica PhD by Lee and the Midwest Canada nurses, as well as Tiffany Reynolds from Soul and Wellness. Greatly appreciate your perspective that you shared. I love to see some individuals jumping in the chat. Continued education in this area. Yes, that is a great step to take. I see, again, some individuals up here jumping in with regard to one word, that they're going to be approaching social equity and justice through social equity with an open mind. It's something that's necessary, a little daunting, but a little bit of uncertainty around. Thank you that you'll contribute to expungement fairs by volunteering. Yes, Audrey. Bahia is working as a healthcare provider to educate those about cannabis. Yes, so there are ways and actions and steps that you can take no matter what your position may be, no matter where you sit, whether you're within the medical cannabis industry or just a member of the community, to contribute to advancing social equity efforts and prioritizing justice in order to do so. So with that, I'll go ahead and take a pause for Q&A. I also have my email listed here if anybody wants to get in touch with me for any additional follow-up, but would love to now jump into a question and answer.
Thank you, Grant. We have our first question comes from Simi Jane. How good are the banks and other loaning agencies with giving loans for starting a cannabis business? It is challenging to start a business when people don't have the financial resources.
Yes, access to capital is something that came up time and time again when looking to analyze the barriers that actually exist to industry participation when we look at that data around ownership. So the banks have not been very particularly receptive to banking cannabis businesses. What has been a financial institution that has been more accessible have been credit unions. So credit unions have demonstrated a considerable amount of willingness to work with cannabis businesses, work with CBD or actual plant touching cannabis businesses that are involved in the more heavily regulated, state regulated medical and adult use cannabis industry. So if you're having difficulty accessing capital, look to credit unions as a key financial institution that can help you navigate that barrier.
Okay. The next question from Charles Wilson, Grant. Are there best practices that address the disproportionate number of arrests, racial profiling experienced by persons of color as it relates to cannabis?
Best practices. So when my mind gravitates toward focusing on the idea that came up that was raised specifically by Ia when I was doing interviews, which was to focus on healing. That when we're talking about these arrests and these disproportionate impacts, that we have to make sure that those communities that were most impacted have the space and the resources needed to heal from the harm caused, from the trauma caused by those disproportionalities. Other best practices are not coming to mind, but again, we have to make sure that our policy accurately reflects those disproportionate outcomes. And so utilizing data by lifting up the data that shows that these are the realities, we can then be more intentional about directing resources to the communities that were most impacted.
And a question from Simi Jane. Drug testing requirements for jobs, referring to non-medical, limits a lot of recreational cannabis users from applying for jobs, which limits employment opportunities. Yeah. Any changes coming in this area?
So no big changes coming until we see some real shifts in federal legislation. At this time, employers can still fire for required drug testing, and like you're sharing, can really cause harm simply for an individual utilizing cannabis in a way that's legal for their state. So no tremendous traction in terms of legislation that is going to provide some shifts with regard to employer policy pertaining to drug testing. It's still going to be at the discretion of the employer as long as they're within the bounds of the law. We're waiting for federal legislation. There are, I know when I was in Soul and Wellness talking about cannabis products that are accessible to individuals that are worried about drug testing, looking at products that do not have THC can be another way that individuals can access the benefits of some of the cannabinoids within cannabis while not putting themselves or their jobs at risk if they potentially have to navigate drug testing. So those are some considerations that I would raise to me. Thanks for the question.
Okay, it looks like those are all the, oh, there's another question that came through. There's also, before that, there is a link for a survey that Via Lee added. If you're a healthcare provider in Michigan, please complete the survey to gauge knowledge, attitudes, and perspectives on medical cannabis. And there's a link there. And from Nicole, can we review some tangible, concrete ways we can move away from being closet advocates in echo chambers to reaching more folks?
Nicole, that's a great question. I don't think I specifically named any tangible ways in the presentation that we can move from being closet advocates to really being in community, being public about our use and support for cannabis. Some recommendations that I would bring to mind is, again, start with you as an individual, right? And those who you have most proximity to. So being an advocate, even within your family, is a great first step for you becoming more comfortable with the language you need to navigate conversations where you're going to receive pushback from individuals who still hold myths about cannabis use. So just starting where you are within your household. And then from outside of your household, getting involved. So one of the ways that I began to advocate more publicly was by joining the Cannabis Equity Illinois Coalition to actually get involved in conversations happening with community around cannabis equity and around making sure that we had a real vision for what social equity looked like in our communities. I see Bahia just dropped some great advocacy organizations that are local to Michigan. Normal is one that is nationwide for those that really are more interested on the policy side of things, as well as interested in specifically advocating to make sure that disproportionately impacted communities, we address the stigma associated with cannabis. So those are some great steps that you can take just immediately. So starting at home, start volunteering, and just continue to refine your language so that you can navigate difficult conversations, because you will encounter individuals who are not proponents, they are opponents. They are working against you, and you have to be ready to navigate those conversations in a way that ultimately allows you to share authentically your perspective and how you're coming to the space as a cannabis advocate. So those are some steps I would recommend, Nicole.
Great. Those are all the remaining questions. I'm going to turn it over to Charles.
So Grant, I just want to thank you for giving us this very comprehensive presentation, and certainly some things to think about as we move forward in this space and on this journey. But before we close, I wanted to talk about our next webinar, which will be entitled Addressing Adolescent Cannabis Use. And our speaker is going to be John Hopper, who's an MD in internal medicine and a pediatric specialist at the St. Joseph's Mercy Hospital in Ann Arbor. Now, the date will be September the 7th at 12 p.m. And so if you're interested, we will definitely have that information available to you, where you'll be able to sign up and register. So once again, I'd like to thank Grant for agreeing to speak to us today, and for all of you for tuning in. And we'll see you next September the 7th. I can't remember if is that a week from today? Approximately. But September 7th at 12 p.m. Thank you very much.
Thanks for joining, y'all. Take care.